The following is a project of our nonprofit newsroom. Support Midcoast Morning and local journalism today at chly.ca/donate. Local news doesn't survive without local support.
Hello and welcome to Midcoast Morning. I'm Joe Pugh. Wildfire smoke was in Nanaimo Thursday, impacting air quality as the Mount Underwood fire continues to burn south of Port Alberni. Kat Pexa is a smoke information specialist with the University of British Columbia's Weather Forecasting Research Team. They run a wildfire smoke mapping service called Blue Sky Canada. Speaking with me on Thursday, Pexa said that winds were expected to move smoke from the Mount Underwood fire away from Nanaimo, but those northward winds could also send smoke from other wildfires our way.
We're seeing that some winds might be shifting up towards the north, and so that might take a little bit of that smoke up and away from Nanaimo, but at the same time, there is a fire on our map just west of Seattle. And with those winds shifting north, we might see some of that smoke move up there as well into Nanaimo.
Today on the show, we'll hear about a project that's been holding workshops on the island and the lower mainland, showing people how to build DIY air filters. But first, for more on the health impacts of wildfire smoke, I spoke with Stephanie Cleland from Simon Fraser University.
I'm Stephanie Cleland. I'm an assistant professor in the Faculty of Health Sciences at Simon Fraser University, as well as a research scientist at the Vancouver Coastal Health Research Institute.
And could you walk me through what we know about some of the health impacts of wildfire smoke?
Yeah, so that's a great question. And it's something we're learning more and more about as wildfire smoke becomes a more frequent part of our lives and our summers in British Columbia and worldwide. So most of the evidence today has focused on our lung health, our respiratory health, because you breathe in the smoke and that's kind of where we see those initial impacts, right? If you have asthma, you're going to have more likely an asthma exacerbation. You may be more likely to have to go to the hospital for a respiratory complication. If you have COPD, again, you might be more likely to have a COPD exacerbation. So a lot of the work we've done today as researchers has focused on that respiratory system. So we know really well that in the short term, so if you're exposed to wildfire smoke today or yesterday, you're more likely to have this adverse respiratory outcome happen within, 24 to 48 hours. We also have a sense that it can affect our heart as well. So there's decent evidence showing that it might increase the risk of heart failure or a heart attack, or people with pre-existing heart conditions might be more at risk of wildfire smoke. So our lungs and our hearts are two places we have a lot of research on in terms of the impacts, but we're learning more and more about different parts of the body that might affect us. So there's emerging evidence showing that wildfire smoke can affect our brains, right? In the short term, it can decrease our ability to focus or pay attention. In the long term, it may actually increase the risk of dementia or Alzheimer's, right? So we're learning that affects our brains. Pregnant women are a particular at-risk group. So if a baby is exposed in utero, they're more likely to be born preterm or born low birth weight. So we're getting more and more evidence that it's not just our lungs and hearts, but it's, babies, it's our brains, it's a lot of different parts and systems of our body that are affected by wildfire smoke.
How does wildfire smoke exposure compare to other air pollutants, things like exhaust or smog, or even like living in the same house as a wood or a gas stove? Yeah,
so with wildfire smoke, at least when we think about, wildfire smoke is something we often talk about as an outdoor air pollution, right? So it exists outdoors. It can come inside your home, right? Through your windows, through your doors. But compared to other types of outdoor air pollution, like traffic-related air pollution or air pollution from factories, right? Wildfire smoke is different in that it's a complex mixture of air pollutants. So it's not just one air pollutant, it's actually this complex mixture of particles and gases. And the composition, so what kind of makes up that mixture, depends on what's burning. So what's in your wildfire smoke is going to be different if it's just trees burning versus if it's something that's burning in the wildland-urban interface, so homes are also burning, right? So depending on what's burning, what's in that mixture changes. And we do know that that change in mixture can probably change the health effects, right? So depending on what's in there, right, and what's making up those particles in wildfire smoke, right, can make that wildfire smoke more or less dangerous to your health. And the other way I think it's really important that it differs is with things like traffic-related air pollution, is you're kind of exposed to that every day, right? Every time you step outside your house, you're going to be exposed to traffic-related air pollution or other things. It's kind of a constant source versus wildfire smoke is this very intermittent thing, right? Most of the year, we're not going to have wildfire smoke in a lot of regions. On Vancouver Island, for example, you're mostly not going to have smoke, but then you're going to have these short periods of really extreme pollution, right? So it's a very different way that we're exposed to wildfire smoke compared to other types of outdoor air pollution. So we get these intermittent, really extreme periods of exposure. And that's a different way to experience exposure, and your body might react differently to that compared to that kind of constant low-level exposure we get to things like traffic-related pollution.
Let's say it's really smoky outside, but I live in a place that gets extremely hot if I don't open the windows in my apartment, say. How do you think I should navigate that situation? How would you approach it?
Yeah, no, that's a really great question and a really important question. I think thinking about not just these exposures in isolation of just smoke or just heat, but we live in a complex world where we get heat waves at the same time as we get wildfire smoke. And the reality is heat's going to pose a much bigger risk to your health, often in the immediate term. So if you don't have air conditioning and you don't have any way to cool your home except for opening your doors and windows, what I would recommend if it's really hot and you do not have air conditioning, I would make sure you try and get your home cool, right? Keeping your core temperature cool is a priority. And if that means you're exposed to smoke, there's other measures you can take where maybe you can wear an N95 mask, right? So if you can't, close your doors, close your windows to try and keep the smoke out because the heat is too high, right? I would recommend wearing a mask or running an air cleaner while also having the windows open, just trying to manage the two risks. But again, in the immediate term, that heat's going to pose a larger health risk than the smoke will for most people, which means managing the heat first and then the smoke second is often the best way to approach it. Ideally, if you can, communities often have what we call clean air shelters or cooling centers. So if you go to your local library, or if you go to a community center, those places often both have air conditioning and often air filtration. So if you don't have a home with air conditioning and you can't really find a way to keep your home cool while protecting yourself from smoke, one of the best things you can do is go seek out those community spaces that are more likely to have air conditioning or air filtration, because that's going to be a much safer indoor environment.
What do we know about the risks, maybe how the risks evolve between situations where, say, you're just outside going about your normal day-to-day activities and it happens to be smoky versus you're doing some kind of, strenuous exercise outside in the smoke?
Yeah, so it's better to be doing lower activity. If you have to be outside in smoke, it's better to be doing lower level activities, right? Because when we think about air pollution, right, if you're exercising, you're breathing much more heavily, right? If you're running or if you're doing something like that, and that basically means you're taking in more of that air pollution. So your exposure to it's going to be higher than if you're doing a lighter level activity like walking. So in general, we advise that if it's smoky, don't do outdoor exercise or outdoor activity that really increases your respiratory rate, because that means you're going to be exposed to more smoke than you would be if you were just walking or doing something like that. And if you have to go outside when it's smoky, we recommend wearing something like an N95, right? Something that's going to filter out those particles in smoke. And again, it's walking in that is much more manageable than having to run in something like an N95. So in general, it's not advised to exercise outside when there's wildfire smoke. So reducing your activity, moving your exercise indoors, and if you have to go outside for a walk or to walk your dog, wearing something like an N95 is advisable.
What are some of the next frontiers in wildfire smoke health impacts research?
Yeah, so that's a great question. I think one of the areas that I and a lot of other smoke researchers are focusing on is thinking about not just what happens tomorrow if you're exposed to smoke today, right? Thinking on this really short scale, because previously we've kind of treated wildfire smoke as this occasional thing. It comes in occasionally in the summer. So that means we only need to understand what's going to happen in the next week after you're exposed. But realistically, we know that smoke is getting worse and worse, and our exposure to smoke is increasing. So what that means is we want to understand not just what a couple of days of smoke does to your health, but we want to understand what 5 to 10 years of smoke does to your health. So say you live in the Okanagan or you live in the interior, somewhere that's very, very smoky. What does it mean when you're exposed to smoke every single summer? Not just this 1 week, but you're exposed for 5 years. Does that increase your risk of developing a chronic disease? So not just exacerbating asthma, but increase the risk of developing asthma in the first place. So a lot of wildfire smoke research is moving towards understanding wildfire smoke, not just on this really short time scale, but on this longer time scale, recognizing that it's an exposure that's not going away anytime soon.
What is your go-to resource or index to evaluate what the air quality is like outside? And maybe how do you read that and how do you make decisions based on it?
Yeah, so I think in general, I would encourage people to check the air quality like they check the weather. It's something I do. So in the morning when I get up, I not only check what the forecast is going to be, how hot is it going to be, is it going to rain? I also check what the air quality is. And the next recommend people using is the AQHI, or the Air Quality Health Index, because it's basically this color-coded index that kind of gives you a traffic light system. Okay, is it safe? Is it kind of yellow? Is it red? And each of those colors or categories of the AQHI have a public health messaging around them. So if it's, for example, in a certain category, by say, if you're in a sensitive group, for example, if you have COPD or asthma, if you're pregnant, maybe start to think about taking precautions, right? Wear a mask, reduce your outdoor activity, versus if it's in the dark purple category, that means it's really hazardous for everybody and everyone should take action. So I think using the AQHI as kind of a simplified way of understanding what the air quality is a really useful tool. And one of the places I often go to look at my local air quality is called aqmap.ca. It's a website. It's an interactive map that has all these air quality monitors. And it's nice because you can kind of get a sense in your more local community, what's the current air quality. So I think aqmap.ca is a really useful resource for seeing what the current air quality is. And it's color-coded by that AQHI indicator, which gets you an easy understanding of how bad is the air quality right now. And given who I am as an individual, right, given my chronic conditions, given my age, given these other factors, how should I act based on what the air quality is?
Is there anything else you feel like it's important to bring to the conversation about wildfire smoke and health impacts today?
I think something that's important is that there's no safe level of wildfire smoke. So I think often people might think, oh, maybe if it's, a more natural source of air pollution, right, compared to cars, right, if trees are burning, maybe that's not as good for my health. But there's no evidence to support that. And we do know that any level of wildfire smoke can pose a risk to our health. So taking it seriously when there's smoke in the air is really important. Again, the risk varies by individuals, but looking at the air quality, understanding what actions you can take to reduce your risk to wildfire smoke is going to be good, and making sure you're taking care of people in your community who might have less ability to protect their health. So making sure not just you, but the people in your community have the information and the tools and resources they need to reduce their exposure to wildfire smoke is really critical.
Stephanie Cleland works in the Faculty of Health Sciences at Simon Fraser University.
Midcoast Morning is part of our nonprofit newsroom project, supported by listeners like you. Keep this program on the air by funding it today with a monthly sustaining donation at chly.ca/donate. We've got tote bags and shirts if you need an incentive.
With Nanaimo's air quality taking a hit Thursday morning, we're focusing on wildfire smoke on today's program. Anne-Marie Nickel is lead of the Breathe Project. They've been leading workshops on Vancouver Island and the Lower Mainland, showing people how to make do-it-yourself air filters to help deal with the smoke.
My name is Anne-Marie. I'm a faculty member at Simon Fraser University in the Faculty of Health Sciences.
And you're working on something called the Breathe Project. Could you tell me a little bit about what that is?
Sure. The Breathe Project is a community engagement and outreach program that this year actually operates across the province. And we bring information to communities about the impacts of wildfire smoke on health, and then show people strategies to help reduce their exposure to smoke indoors.
And I know one of the strategies you've got is helping people to build DIY air filters. Could you tell me more about that?
Sure. We've learned over time from academics and other researchers that DIY air cleaners are a useful alternative to commercially available air cleaners. And people enjoy building them, and they can run them, and they will help effectively reduce the amount of particulate matter that is accumulated indoors in people's homes.
So what exactly is in a do-it-yourself air filter? How do you build them? What do you build them out of?
Yeah, well, the details are very important. So you need to have a MERV 13 filter, a 20 by 20 box fan, minimum of 75 watts, and then you need some duct tape, although in some places that people just recommend even bungee cording the filter to the fan. And then we like to decorate them afterwards and put stickers on, but that's not 100% necessary. And all of these things are very easily accessible at a hardware store. So you can take your shopping list and go to Home Depot or Home Hardware, and you need to go to the furnace aisle and then the fan aisle and get some duct tape. And that's pretty much it.
And what is maybe the why of someone building one of these air filters?
Well, often we tell people that it's important to go and stay indoors when it's smoky outside, because air quality can be so poor outside, it can lead to serious health effects. But the reality is that outdoor smoke doesn't just stay outside. It can come into the home. The process is called ingress, but it can come in through doors and windows or cracks and gaps. And over time, if you've been in a smoky region for a while, you can start to get smoke in your home as well. And it's also, for some people, keeping cool is important as well. So they have to leave doors and windows open. And in those circumstances, again, smoke is able to come into the home. So if people are basically having to shelter in their house or stay inside, you want to also make sure that the air you're breathing inside is safe as well. And that's why governments around the world recommend air cleaning or air filtration of indoor air to help reduce the risk of health effects from smoke while people are staying inside too.
Now, if I'm looking around online at just buying an air filter or an air purifier, it seems like there's a range. There are some ones that go from, say, $150 to some that are like $300 or $400. How much do you reckon it costs to put one of these DIY air filters together?
Ours are the materials. If you went to Home Depot and bought the materials that we recommend, it's under $100. It depends on if you get the fan. Sometimes fans go on sale. And these are box fans, so window box fans, and they're always in stock. We've never really had a problem finding them. You can buy commercial air cleaners. You can spend, as you said, lots of money. One of the other hidden costs is the replacement filters. Some of the fancier units have expensive filters. We've talked to people who bought air cleaners years ago, but now they don't continue that model anymore and they can't find the filters for them. It's like buying a printer and then, you're forever having to spend a lot on expensive ink. So the joy of the DIY air cleaner is it's pretty easy to go back to a hardware store and just buy that same 20 by 20 furnace filter that you bought before, because they're always pretty much in stock. And the price is usually about $20, $25.
And how effective are these do-it-yourself filters?
They operate at about the same level as a commercially available product. And the ones that we make tend to work best in smaller spaces, like a bedroom. You can buy bigger units to do larger rooms, and you can also make a larger DIY air cleaner with 4 filters that would operate at the same level as a much larger unit. But again, this take up a lot more space. And this project was really started as a way to help lower income people or seniors with COPD help make their indoor air easier to breathe. And we focused a lot on communities who might not have large spaces that they have to clean. So if you are the person who wants to make your own air cleaner and you have a big space, you can actually make a bunch of little ones, or you can read our directions for how to make a big 4x1, they're called, or it's also known as a Corsi-Rosenthal box. You can learn how to make one of those on our website as well. And they're really powerful. You could use them to do like a classroom-sized space.
And you've been hosting workshops on how to build these things, and they have been really well attended, is what I've read.
Yeah, that was in 2023, using evidence that was generated from the National Collaborating Center for Environmental Health. That's a FAC-funded project, a federal government-funded project that operates at the BC CDC. They had done a rigorous review of whether or not this technology works or not, because it was being promoted during the COVID-19 pandemic as a way of reducing respiratory pathogens inside. And that the unit I spoke about, the 4x1, was designed in part to help keep classrooms safer from respiratory pathogens. So respiratory pathogens tend to be very small particles, just like the particulate matter in wildfire smoke. So our question was, are these units, do they work? We're recommending that people build these. What is the evidence that they work? So what we learned over time was that, yes, they are effective. And they, similar to a commercial grade, you have to have these exact right ingredients to the right wattage of the fan, the right filter, the right size. But if you get all those things correct, and it's not hard to do that, then you can build something that functions at the same level of something that you could buy in a store.
If I'm trying to build this myself and I'm a little bit worried, that how do I make sure that it's working and I've got it correct and there isn't like a loose connection or a part in the wrong place?
It's pretty easy to put them together. You just need to be able to, use some tape. So it's a 75-watt box fan, a MERV 13 filter, and literally a roll of duct tape, and you just tape the filter to the back of the fan. And we also built what's called a shroud on the front. So we put tape on the front of the fan, and people often ask, like, what is this for? And there is some refined science that's gone into it. I joke that it's not rocket science, but it's ventilation science. And it turns out that a square fan has a round series of blades on the inside. And when it gets going, actually the air gets sucked through the front of the fan. And so we want all the air to go through the back where the filter is. So we tape off the front. And I know it's a bit hard to see on radio, but if you go to our website, you can see this in action. But the shroud just helps improve the efficiency because it forces all the air to come through the back and go through the filter. And so we're not wasting energy pulling clean air back through the fan, which would happen if you didn't build the shroud.
If someone's interested in this idea and they want to learn more, where can they go to find more info? Maybe the instructions on how to put one of these together.
There's a few different places. We work with the BC Lung Foundation. They have a nice provincial overview. They work with communities across BC, many of whom already have COPD or other lung conditions. So we started partnering with them in 2023 with the idea of, will people come to workshops to learn how to make DIY air cleaners? And so they helped financially support us to do that. And what we learned was that, yes, there's a real sort of desire on the ground from people in communities where it's smoky to learn more about what they can do when times get tough. Like right now, it's quite smoky on Vancouver Island. And I think people are looking around for information on how to stay safer. And everyone knows when it's smoky, like your eyes are irritated and you're coughing. So it's not a surprise that smoke causes health effects. But what we were surprised about was how many people showed up to the workshops and how excited people got about being able to make something that helped themselves. Like this real sense of agency, like I can build this thing and I'm going to run it. And then you can see on the filter, because it's not tucked away, you can see how dirty it gets fast. So I think it's also sort of an educational experience. I'm like, wow, what's on that filter was going into my lungs. And that it's impressive that you're able to reduce that with just this simple thing that you made from stuff from the hardware store. So I think for me, that was one of the biggest surprises in the beginning was, how willing people were to come. We've had kids all the way up to our oldest participant was 99 years old in the interior, and people are able to make them on their own. In the beginning, we had a different recipe that required cutting cardboard, but for people who are older or have arthritis, that's too hard to do. So that's why we switched to the duct tape. And people come and they have questions and then they stay. Like that's the other surprise, is that people stay for up to 2 hours. They have tons of questions about smoke and their health and what to do and where to go in the community for cleaner air spaces. And then people get to visit, meet other people they might not have already known in their space and talk about climate change.
So a box fan with a furnace filter essentially duct taped to it, that will do an equivalent job to an air purifier I buy in a store if I've set it up right?
That's correct. Yes. And so we have instructions at the BC Lung Foundation. We host, if you type in DIY air cleaner and BC Lung, you will come to our website. SFU also hosts a site. And then the US EPA has some also great resources. They also recommend that people build these units either during smoky periods or for other things. So that's another interesting segue for this project, is that the air filtration capacity of these units is such that they remove many small things from indoor air. So that includes not just respiratory pathogens and the PM 2.5 and wildfire smoke, but it also reduces allergens and dust particles, anything that's a granular particle, road dust, traffic-related air pollutants. There's things that build up on the back of people's filters. I have a wood stove in my home, and mine, when I ran it next to the wood stove for a while, it became black pretty quick. So there's all sorts of indoor air pollutants outside of wildfire smoke that these units are very good at trapping. And so we have people we know that we've followed up in our research, and they just use them every day, all year long, because they are having better indoor air is going to improve people's health, full stop.
Do I have to put it near an open window or anything, or is there a particular place that it makes the most sense to put these within a room? So one of the recommendations is if it's very smoky, one of the things that you want to do is create your own indoor clean air space in your house. And that would be a room that you could pretty much close the doors and windows from. They recommend finding a room that has a bathroom off of it if you can. So close it up and then run the air cleaner on high for a while and keep your family in that space. So if things are extremely smoky, consider creating this sort of clean air space in your own house. That's what you'd want to do in a heavy smoke situation. Otherwise, you can run them in a bedroom, a place that you spend the most amount of time if you're going to clean the air. And you can really feel the difference when you use an air cleaner. There's like a relief of walking into a cleaner airspace that you will feel. And a bedroom's just a good place. They tend to be smaller spaces. And it's also where people spend, hopefully, a good 8 hours of their day in this breathing in cleaner air. If you have to keep windows open to stay cool, because extreme heat is actually far more dangerous immediately to health than smoke is, then you could put it near the place where you have the open window, yes. We want to make sure that people know that staying cooler is more important than staying smoke-free. But otherwise, the only real caveat is not getting them wet. So once the filter gets wet, it doesn't really work that well anymore. So putting it in a window is not ideal, especially if there's the potential for rain. Anne-Marie Nickel, thank you so much for taking some time to talk to me about this.
Thank you. I really encourage people to learn about how to make the air cleaners. You can have the materials on hand if suddenly things get really smoky, but I feel like the indoor air quality issue is kind of our last frontier. We think about pollution as something that is external to us in our house, but the reality is that many of those outdoor air pollutants can come indoors, and that we have a whole range of indoor air pollutants that we need to think about as well, things that come off of carpets and particles and other things. So keeping your indoor air space healthy and clean is a really important thing you can do for you and your family.
Anne-Marie Nickel is lead of the Breathe Project and a faculty member in the Faculty of Health Sciences at Simon Fraser University. That's our show for the day. Thank you for joining me. I'm Joe Pugh, host and producer of Midcoast Morning. Jesse Woodward is our executive producer, and Arby Frew is our technical advisor. Our theme song is First One by local Nanaimo band Waste Management. If you have a story you'd like us to cover, email us at news@chly.ca. That's all for now. I'll talk to you on another Midcoast Morning.
This program gives thanks to the Snuneymuxw First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.